Good afternoon, everyone, and welcome to our session. I'm Dr. Anoushka Amlani, and on behalf of Voice of Healthcare, I welcome you all to the fourth and final session of the National Virtual Roundtable on National Anemia Awareness Day. The theme for today's panel discussion is Advancing Hematological Health Mission Anemia Mukt Bharat. The prime focus for today's session will be on understanding the significance and impact of the Anemia Mukt Bharat initiative and National Anemia Awareness Day from the government's lens. We'll also be exploring the diversity of anemia, like sickle cell anemia, and understanding several other rare disorders. We'll be discussing the characteristics and advanced diagnostic approaches for anemia and navigating different treatment strategies. This campaign is an initiative of Voice of Healthcare and is kindly supported by Zydus Life Sciences in the issue of public health awareness. I would now like to introduce our esteemed panelists for today's discussion. Dr. Geeta Kakodkar, Directorate of Health Services, Member Secretary, State Health Society, Goa, National Health Mission. Thank you for joining us today, ma'am. Mr. Gautam Dongre, Secretary, a National Alliance of Sickle Cell Organizations. Welcome, sir. Thank you for joining us today. Dr. Abhay Bhave, Hemato-oncologist, Mumbai. Thank you, sir. Thank you for joining us today. Dr. Chirag A. Shah, Director, Department of Cancer, Blood Disorders and Stem Cell Transplant, Bone Marrow Transplant at Apollo Hospital, Ahmedabad, Director of SHYAM Hem-Onc Clinic. Thank you for being with us today, sir. Dr. K. Madan Gopal, Advisor, Public Health Administration, NHSRC, Ministry of Family and Health Welfare, Government of India. Dr. Mukesh Rolania, Medical Oncologist and Hemato-oncologist, State Cancer Institute, SMS Hospital, Jaipur. Dr. Mukesh will be joining us shortly. Thank you all for being with us today. Moving forward, I would like to ask my first question to Dr. Gautam. Sir, can you please share information about the National Alliance of Sickle Cell Organization and how has it benefited the citizens regarding the awareness?
First of all, thank you so much for inviting me of Voice of Healthcare. National Alliance of Sickle Cell Disease Organization is an umbrella organization, like-minded organization, those who are working for sickle cell disease in different states. So, as you know that 17 states of India are more prevalent with sickle cell disease. So, out of 11 states, we have the member in our National Alliance of Sickle Cell Organizations. 25 plus member organizations are there, and we are all executive members are from sickle cell family. Except me, all sickle cell executive members are warriors, and I am a parent of 2 sickle cell child, and also a trait of sickle cell disease. So NASCO is working pan India for the awareness of sickle cell disease, because we knew that we are the patient, we are the survivor, that this disease is not very easy to live with this disease whole life. It's very dangerous. So we decided to work for the awareness of the sickle cell disease in India, and with the help of government, with the help of other stakeholders, we are trying to aware the people. So NASCO is working for especially to aware both of the people as well as professionals also, because we organized a state level conferences, national level conferences, and international level conferences with the help of all stakeholders to educate and empower all of the community. So, as the professional people educate, it will very easy to catch the sickle cell disease patient as early as possible, and the treatment online go, and we can save the life of the people. So, NASCO is working with the Ministry of Tribal Healthcare since last 3 years to form the sickle cell mission, and we are very thankful to government of India that they have decided to, and they have announced the sickle cell mission in last year. NASCO is also voting member of Global Alliance of Sickle Cell Disease Organizations, so we are the member of Global. I am personally a board member of the Global Alliance of Sickle Cell Disease Organization, and also in the various policy making committees, I am also participating on behalf of sickle cell community. So NASCO is working for especially for awareness all over the people. Thank you so much.
Thank you so much for your insight, sir. Moving forward, my next question is to Dr. Abhay. Sir, kindly elaborate the challenges regarding diagnosis in anemia and how do hematologists play a key role in navigating and treatment strategies and spreading the awareness?
So, thank you, Dr. Anoushka. I hope I'm audible.
Yes, sir, you are audible.
Thank you so much. Thank you to you and the VOH platform, along with Zydus Life Sciences, for the opportunity to be on this esteemed panel. And of course, it gives me great pleasure to see Mr. Dongre there, who I'm now listening to him and I see the amount of work he's put in. So, fantastic. Well done, sir. Now, the question that you posed to me is about our role as hematologists and the challenges that we face. So, I'll just quickly tell you that anemia is not a diagnosis, it's an event. And it has a huge impact on the community. Psychologically, physically, productive, reproductive, especially in the pregnant women. And in the pregnant women, having iron deficiency anemia especially impacts our progeny, our future. If you look at the kind of burden that we have in our country, you'll realize from published data that more than 15 states in our country, where analysis was done, they have a significant amount of anemia. It can be as much as 55% or even higher. Some states it might be even more, depending upon the geographical locations. And this is all despite, if you look at the NFHS 4 and 5, we are seeing a higher incidence despite all the government efforts to make anemia more aware. Um, so if you look at the challenges that anemia is an event. It's not a diagnosis. It's not like diabetes. Sugar is high or hypertension where the blood pressure is high. I mean, yes, that's an event. We have to find the underlying cause. And therefore, the challenge is there, trying to evaluate, sift through the event called anemia. And it could be as much as, say, iron deficiency or B12 folic acid deficiency. It might move away to thalassemias or hemoglobinopathies, sickle cell, as Mr. Dongre is working on, and others hemoglobinopathies. In the northeast, we have hemoglobin E. We have got in Punjab hemoglobin D. So different geographic areas give different kind of hemoglobinopathies, which we need to detect. And then the rarer causes like aplastic anemia, paroxysmal nocturnal hemoglobinuria, hemolysis, and of course, the most feared leukemias as a cause of anemia. However, these latter ones which I spoke about are much less in terms of frequency. So actually, we should be discussing more about common problems in our community because they are commonly not addressed, and that's why we are facing problems with them. And the other challenge with this is that sometimes there is a kind of combination. So you might have an iron deficiency with B12, you might have an iron deficiency with thalassemia or a sickle cell disease, or they might be underlying bleeding disorder. So anemia has to be looked at in a very particular manner, and that's why it's very important to have hematologists play a very important role in managing this. By the way, there might be certain other events in the patient's life, like chronic diseases, renal diseases, rheumatological diseases. Many patients undergoing transplant, they all face anemia. So their conditions are different. Some people are taking medications, they can also cause anemia. And there are some who undergo surgery, develop a loss in hemoglobin because of bleeding, and they can develop anemia. So it's too multifactorial to give you an answer saying, yes, this is the answer. And therefore, if anemia is not a diagnosis, it's an event, we need an algorithm, and this can be successfully done if we have a approach. So the hematologist's key role is trying to establish an approach wherein we can kind of sift through all these causes of anemia and try to give us a kind of a thought process towards this. Looking at the patient's symptoms and doing what is called as CPC is very important. CPC means clinical path correlation. That means you got a patient who's giving a history, you ask additional history, you do an examination, and then you look at investigations, not going straight to investigation, because that's where from a huge differential you can come to a narrow differential based on what kind of history and examination. I'll give you some examples quickly. If you see flat nails or spoon nails, it's very typical of iron deficiency, although we don't see it so commonly now. If you see white hair, not like mine is age, but if you see white hair, then sometimes that is associated with B12 deficiency. Hunter's tongue, that means a bald tongue, B12 deficiency. Hyperpigmentation of the skin around the nails, B12 deficiency. Having recurrent diarrhea, folic acid deficiency is more common. So there are some pointers in clinical medicine which can tell you what is the likely diagnosis. However, you need a CBC. You cannot make a further analysis of anemia without doing a CBC. So the next thing that we have a role in playing is after doing a CPC and examining the patient to look at a quality assured CBC. That means a complete blood count done from a quality assured blood counter. And for me, the ABC of CBC means ABC for me is a proper assured blood cell counter, something that is an automated blood cell counter which is quality assured. That's extremely important. Otherwise we'll get wrong answers and our thinking will go the wrong way. And this should be followed by a very good stained smear. So CBC will tell me what type of anemia it is based on the indices that come out, and a smear will sometimes make me even give a diagnosis. CBC will not give me a diagnosis. It will just tell me what the numbers are. But the peripheral smear can pick up what Mr. Dongre is talking about, sickle cell. It can pick up sickle cell disease, iron deficiency, megaloblastosis, B12 folate deficiency. It can pick up malaria as a cause of anemia, hemolysis, cancer cells, microangiopathy, which can give rise to severe anemia and can cause a lot of distress to patients in the hospital. And sometimes beyond the CBC and smear, you might need to do additional tests. That's where the challenge is. Sometimes it is hemoglobin electrophoresis to pick up sickle cell and other hemoglobinopathy. It's a bone marrow examination sometimes. Sometimes for hemolysis, we need to do direct Coombs test. Some of these tests may not be available in the institution. Some of them may not be affordable to the person who is there. So many times the doctor's role, the hematologist's role, is to make this clinical path correlation, see in the experience in a pattern. We call it pattern recognition. How well we can recognize the pattern and see most likely this is a diagnosis if I don't have a compelling answer. And my biggest challenge that I face, my last point of the challenge, is that sometimes insurance does not cover certain investigations on OPD. And there are many investigations of anemia which we do on OPD because they don't need admission. My plea to the government authorities is that somehow insurance agencies have to be implored upon that certain investigations have to be done on OPD basis, and they should be respected and they should be accepted, and the patient should not be paying that money out of the pocket, because this prevents them from doing investigation. This is making people get unnecessarily admitted in the hospital, and we are taking up hospital beds for people who actually don't need them, and genuine patients are being denied a bed in a country where the hospital beds are very less as compared to the population. So looking from that point of view, insurance also has to be taken care. So we face all these challenges.
Thank you so much, sir, for your clear and detailed insight. Moving forward, my next question is to Dr. Chirag. So, what's the level of awareness and importance of chemotherapy related anemia?
So, talking about the level of awareness for the transplant, uh, or can you repeat the question? Sorry. Uh,
So, what's the level of awareness and importance of chemotherapy related anemia?
okay. So, I think the level of awareness for anemia in general has increased a lot, and the various anemia subsets that Dr. Bhave very clearly defined are a challenge that needs to be clarified. Uh, the chemotherapy related anemia in the whole very larger population, I would say, is a much smaller number, because the uh, out of all the population, with about 40-50% population being anemic, the chemotherapy related anemia would be maybe 1% or so. But uh, you know, to take it further, uh, from what Dr. Bhave said, that if you were to think of the hemoglobinopathies as a very important cause of anemia, then awareness about not just its diagnosis but prevention is very important. See, what has happened is that thalassemia and sickle cell disease are otherwise preventable by prenatal testing. So, in Gujarat, for example, there is about 4% population is thalassemia minor, and in probably in the country also in that range. The number of new thalassemia patients born each year in India are anywhere from 12 to 15,000 as per various estimates. So, new patients who are going to need lifelong transfusions. Okay? Uh, this is completely preventable by prenatal testing. In Italy, Cyprus, in those countries where the incidence of thalassemia minor is 11 to 13%, the new thalassemia major babies born every year is nearly zero. Okay, with very widespread awareness and prenatal testing. So I think we have a very good awareness, I would say, to a large extent about thalassemia major. We have very, I mean, at least in the major cities, fair availability of prenatal testing capacity, and it is affordable, and yet it is not implemented. So while we have government authorities also, here I would like to say that this part needs a major push. uh, Government has been very strict about the fetal sex determination, and through the law and its implementation, it has improved that ratio significantly. Whereas on thalassemia major, a completely preventable disease, this has not happened. And I think that is something very, very important. If we can bring down the thalassemia major number, newborns, from 10,000 to 15,000 down to say about even 1,000, even that would be a great service. And it is very easily doable if because the all the pregnant women would practically be going to major hospitals, clinics, government hospitals. So it is not that we have to, it is not very difficult to find them. The prenatal testing uh, can be easily implemented if this is done, in a very proactive manner. So I think one of the very important thing to do with a long lasting impact, because we cannot cure thalassemia without transplant, and today the number of transplants done in India per year for thalassemia is about 300, and we have 10,000 plus new patients born every year. So we can never catch up on this, and it's an expensive treatment. So prevention is the only answer.
Thank you so much, sir. My next question is to Dr. Madan. Sir, Government of India launched AMB in 2018. How far has the strategy proven to be successful in reducing anemia?
Uh, Thank you. One of the important things you have rightly mentioned that the strategy is there. It's, uh, but the evaluation, how far it has been able to be successful, that we will only see when the other round of NFHS 5 comes in, when the result of this NFHS 6 will comes in. But still, the available data, the whatever available data is there, it has shown that the uptake of the program has been quite very encouraging. From the uptake of this iron folic acid has increased from 75% to more than 95% now. So this thing has happened, but let us wait for the survey which is currently being undertaken, and we will be able to at least understand what the program has been made to impact. But the 6 into 6 into 6, all the three strategies, that means six type of beneficiaries, six institutional mechanisms, and six interventions. They are trying to be uh, 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 at least bringing some results into the on the ground. If you look at the beneficiaries, that means we are trying to cover around children of 0 to 6 to 5 years, around 11.2 crores children we are covering. We are trying to cover the children, other children also 5 to 9 years, and we are trying to cover the adolescent children, then pregnant women, and the reproductive age women plus lactate women. These are all the six beneficiaries we are trying to target through this. And the results are very encouraging. If you look at the way how many people have been covered for this IFA supplement, because that's the only way where you can at least on a mass scale like this, in a community level program, mass scale like this, at least you can reach the people. The only measurable is we do have measures for doing hemoglobin estimation. But after hemoglobin estimation, we have to give them some intervention. The intervention is in the form of iron folic acid. Now, separate algorithms have also been made. That means for how long the severe the work is in progress for developing algorithm ki how long the severe anemic children and the pregnant women or the women in reproductive age group or lactating women, they would be given treatment so that they can be brought into the moderate level, and from the moderate when for how long they would be given, that is still work in progress. But if you look at that, how many people are being covered through iron folic acid supplementation, you would be very happy to note that around out of this 11 crores, 5.8 crore children in 6 to 59 years of age, they have been covered through this iron folic acid. The though everyone that there might be a question saying that they are not consuming, but you see the reach and the magnitude and the problem which we are trying to address for a mass scale of thing, and doing things on a one-to-one basis or a clinical settings, they are very different. We have been able to reach around 3.6 crore 5 to 9 year children, 4.2 crore adolescent children. Out of this, women, we have been women of reproductive age. We have been able to reach around 2 crore pregnant women, and lactating women also similarly we have reached. But if you look at the six interventions which we are trying to do, one of the six intervention is providing prophylactic iron supplementation. If you look at the prophylactic is a key intervention to give IFA to children, adolescent, and the women in the age group. This is one intervention which we are doing. Besides that, biannually we are doing a mass uh, deworm, deworming mechanism for the children in the age group of 1 to 19 years, which is carried out in a designated days every year under the National Anemia Book Deworming Day. The Anemia Book Bharat also integrates the deworming of the women in this age group. Besides that, we have trying to focus on four key behaviors, that is improving compliance of iron folic acid implementation, deworming, appropriate infant and young child feeding practices, increase of intake of iron-rich food through dietary diversity and other things, and ensuring delayed cord clamping after that. These are all the interventions which we are trying to see. Besides that, we are trying to have a testing of anemia. To what is meant by testing of anemia, screening and testing of anemia, because they are very important in all age group, so that appropriate treatment can be. We're trying to focus more and more on point of care device testing, so that we can test and provide the treatment then and there only to the women. Besides that, the government has also mandated the use of fortified salts, wheat flour, and oils in food served under integrated ICDS programs. Midday school meal, as well as any other scheme, so that micronutrient deficiencies can be addressed. Besides that, we do have an institutional mechanism. We have focusing on six institutional mechanism. At the national level, we are having a national anemia Mukt Bharat unit. Then an interministerial coordination mechanism has been established. The supply chain, previously there used to be complaints about deficiency of iron deficiency anemia, as well as the non-availability of albendazole. That is also been strengthened. The supply chain has been strengthened. Then convergence with other ministries, that is also being strengthened. Then National Center for Excellence of Advanced Research in this, which is at AIMS Delhi, that is there. Plus, besides that, to keep track of the interventions which we are doing. A Anywhere Mukta dashboard has been developed, a digital one-stop shop solution, so that you can have all the information regarding this anemia at one place. All these measures are happening; they are being implemented at the Center for Excellence. They are developing. They are already ongoing research to improve the behavior as well as uptake of the scheme. They are trying to build in algorithms, bringing on more ease of intervention, so that with these algorithms, we will see that when to start treatment, when to stop treatment, when to shift women from one category to another category, what kind of other iron forms and other this, so that the research element is also there. Besides that, if you look at the Anemia Mukt Bharat dashboard, that will give you a stop in one place, all the information would be available. But the question which you have asked, that whether the evaluation is there, yes, evaluation is underway. Let us wait for the next round of survey, and we will have what has been the impact of this the government intervention and other things. I will stop here. Thank you.
Thank you so much, sir, for your detailed insight and statistics. Moving forward, I would like to request Dr. Geeta to kindly make her keynote address.
Directorate of Health Services. Today the discussion point is about anemia in Goa. In Goa, we have seen the prevalence of anemia in women has increased from 53 to 57% between NFHS 4 and NFHS 5. Also, in children below 5 years, the prevalence of anemia is said to be 67%. This is very concerning to us because we have successful implementation of all the programs like Anemia Mukt Bharat, like deworming day, JSSK, and still it has not achieved the desired results. We are trying to audit and find what is the reason for this increased prevalence and what is the reason for anemia in these groups. We do a lot of activities like in the vulnerable group, that is children and pregnant women, we are giving them supplemental iron. Pregnant women, we see that they take 180 tablets of iron throughout their pregnancy and in the initial part of the lactation period. We are also the registrar of marriages also gives us a list of the newly married couples, and we are offering them counseling and testing services. In adolescents, our school team has several sessions educating them about eating good food, fiber-rich food, and food rich with nutrients. The problem presently is we are moving out from a traditional high fiber and nutrient diet towards easier options like fast food and ready-to-eat foods. With working women and with the stress of normal life and with fussy children, all these things are very difficult to target because time is limited for most women who are in the workforce. Besides, the children also prefer eating these kinds of foods. So we have to work towards education, and we have to work towards awareness more, which we have realized. Also, besides this, we have to reduce the anemia in under 5 children. So Anganwadi visits are done, line listing of the children are done who are anemic, and they are followed up. We are also actively involved in the education of school teachers who spend a major part of the time in a child's life. so that they also can speak to the children and they see that the dietary habits are changed and we move towards a anemia free Bharat. So we also there are other things like our ANMs, that is auxiliary nurse midwives, who are doing house to house visits. We have given them educational material, and they also are raising awareness about eating right and taking supplemental iron and all these things. We are also doing capacity building of all the staff who are in contact with the patients, and so that the training is done by our nutritional counselors and it reaches to the larger audience in the public. We are making use of social media platforms and radio and other print medium and all to raise the awareness among the people. The challenges we have presently are the acceptance of the iron and folic acid tablets in schools is not so good. Secondly, like I said before, the eating habits have changed. So the work and the home balance, and plus the stresses of coping with the fussy eaters and in children and all that, that is taking a negative spiral down in the case of anemia. What are the solutions for this? The solution is, first of all, we are trying to see a database of our own, for which we have tied up with the Preventive and Social Medicine Department of Goa Medical College, who is doing a survey of anemia in children and in women. Also, we are trying to see that there is a better monitoring of anemia cases. We also have a call center uh, in which all the PHCs send the data of the children requiring attention, those children who have malnutrition, anemia, and these call centers calls the parents regularly and also counsels them. This is our 104 call center, which we have in collaboration with GVK EMRI. Then we also are in touch with the education department to find better option for midday meals, to raise the funds for midday meals so that the children get nutrient rich food. And also we are trying to enhance surveillance. In the long term, we are hoping for a reduction of anemia through all awareness activities, through better eating better options, and seeing that the pregnant women are detected early for anemia and followed up, and they take better iron tablets which are absorbed. So we hope to have an anemia mukti Bharat. Thank you.
Thank you so much, ma'am. My next question is to Mr. Gautam Dongre. Sir, how has Anemia Mukt Bharat contributed to spreading awareness about sickle cell anemia, and what more can be done to enhance government and public-private partnerships, basically?
Yes, actually, there is a sickle cell disease elimination mission also launched. So I must tell you about the mission that Ministry of Health and Ministry of Travel joint efforts for this sickle cell elimination mission. Honorable Prime Minister has announced in last July 2023. So in this mission, they have targeted next 3 year to screen a tribal population of 0 to 40 age uh, in all 17 states where sickle cell is more prevalence. So they have started screening, and which is very appreciable that government is aggressively they started this screening of the tribal population. I must share in your platform that not only in tribal population, but the sickle cell is in other classes also, just like a scheduled caste and other backward classes also. So we can understand that in first phase, government will target the tribal population, but simultaneously, I will request in your platform that other community is also more prevalent. Just like in Maharashtra, there is scheduled caste is near about 80% more prevalence of sickle cell disease than scheduled tribes. In Chhattisgarh, also more than 50% other backward classes are affected with sickle disease. So it is different in different states. So we must target the community to for the screening of sickle cell disease in this at least 17 states. Secondly, I must, as a sickle cell advocate, I must tell you that the problem we are facing regarding diagnosis in the right time of the sickle cell disease patient, and the problem is there the need of training to the professionals, like from start from the ASHA worker, counselor, PSC, CSCs, doctors, they must train regarding sickle cell disease treatment and diagnosis. In this sickle cell mission, it will definitely success when in first phase we should train to the professionals. Otherwise, the mission will not be success because the patient don't know the what is the disease they have, but the doctor can understand when they come with the symptoms of anemia, when they come with the symptoms of uh, jaundice and regular joint pains, then doctor should analyze that and test regarding sickle cell disease. So my request is to anyhow any condition with the government, please train to the doctor, paramedical staffs, ASHA worker, one time from the hematologist point of view, that what is the treatment. Just like a hydroxyurea is the only treatment which is right now available for the sickle cell disease treatment. We can say that the it is a manageable drug managing the symptoms. Treatment is the only bone marrow transplantation, and as the doctor early shared that we can't afford. Just Dr. Shah sir said, I think that thalassemia patients are not eligible, not able to make a bone marrow transplantation because of the cost. Same things with sickle cell disease also. We have 14 million sickle cell patients in India, and every year 50,000 new births happening in India with the sickle cell gene. So bone marrow transplantation is right now also not reachable from our hand because Coal India Limited not funding us. So we have the option of hydroxyurea capsule only, which is very economic, only 2-3 rupees per capsule. But it is very important drug right now because it managed to the sickle cell patient. 90% sickle cell patient of our India hydroxyurea can manage because. But the doctor should know the what is the dose, proper dose of hydroxyurea, when to give, when to stop. These all things professionals should know. So I must raise this issue, and in this platform, I must share that everyone should get screened about their genotype because thalassemia, sickle cell, and hemophilia all are blood disorder. We can prevent it by only testing. So before marriage, we should all people take test of the your genotype, and please got to know that what is your genotype. So this is my request, and thank you so much for giving opportunity.
Thank you so much, sir. Moving forward, my next question is to Dr. Abhay. So, what is the incidence of iron deficiency anemia in the western region of India, and what all options are available regarding treatment? Also, how has Anemia Mukt Bharat helped in spreading awareness and reducing the patient load?
Thank you very much, Dr. Anoushka, for that question. So, when I was looking at data from across the country, really it didn't make too much of a difference which geographical part of the country you came from. The incidence of anemia is rather similar. Like I said, more than 15 states at least have an incidence of anemia which is exceeding 55%. The causes of anemia, like I earlier mentioned, might vary from state to state. So you'll have more incidence of sickle as you go towards the northeast, and for us in Maharashtra, it's even Nagpur. And as you go towards the south, it will be iron deficiency. You might not see so much hemoglobinopathy. As you go towards the north, you might see more of hemoglobin D disease and other conditions of B12 deficiency and iron deficiency. Haryana has a significant number of anemic patients. So I think it's similar in terms of West and non-West, with anemia being commonest is due to iron deficiency. Next is, of course, B12 deficiency and folic acid deficiency. Then comes the thalassemias. The rarer, it's difficult because we don't have a national registry to report rarer forms of anemia. And therefore, it's hard to tell you what the incidence might be. But I'm confident that every state sees rarer anemias also, but the commonest would still be the deficiencies. And in terms of the understanding of types of anemia, if you look at rural versus urban population in the same state, really that gap is closing. Not much of a difference between the two, because probably the digital media and its reach is much more superior now. So eating habits have changed similarly between different populations, and that's why probably the gap between rural and urban is now closing, and we are seeing similar kinds of incidences happening in them. I don't really see in my private practice in Mumbai that the social structure is making a difference in anemia. Even the better class who have access to good food are also coming to me with anemia. Their causes may be iron deficiency or other deficiency or something else, but it's not social structure bound. Similarly, I'm not seeing too much difference between vegetarian, non-vegetarian. In our medical college days, we were told non-vegetarian food, and quite rightly so, because non-vegetarian food is absorbed through the intestine through a different mechanism as compared to vegetarian food. So we thought that non-vegetarian food, especially meats, especially red meat, is associated with better iron absorption. But I'm not seeing that now. I mean, even in the Western states, if you see, anemia is rampant, iron deficiency is rampant, and these are major red meat eaters. So I'm seeing a lot of differences in the way anemia is kind of percolating into our lives, irrespective of social structure and eating habits. So it's hard to give an incidence, but I think incidence everywhere is the same. What was your next question? Sorry, one was about the incidence of in the Western
So how
state.
has Anemia Mukt Bharat helped in spreading awareness and reducing the patient load for anemia?
Right, right, right. So I'm very thankful to the Anemia Mukt Bharat of 2018, where they said 13th February will be the World Anemia Day, 13 being the number, the hemoglobin number that they want for all of us so that we are non anemic. I must tell you, we don't have a proper range of hemoglobin in our country because we're ethnically so diverse that it's very hard for us to know the range, the correct range of anemia in our country. But 13 is the target, and Anemia Mukt Bharat is the one which is creating the awareness. But I feel that while it is there on board, its percolation into the common man's domain has not reached the level it should have reached. So I still feel that anemia is a common issue in the community, but it is not commonly addressed. People don't know what the symptoms are. People are fatigued at the end of the day, and they attribute it to workload, to running behind trains and buses, and climbing stairs, and work environment pressures. So that is given more importance rather than it could be anemia, which is highly treatable, which can ameliorate all these symptoms. So that kind of awareness to the common man, that your symptoms may hide something deeper inside, which if diagnosed and treated will eliminate these symptoms from you, has not reached. So they understand that there could be symptoms, but they're not coming to the doctor for the same. If that could be made aware through, say, TV programs, popular TV programs in different channels and different languages, if that can be put in, or at theaters, like how Tata Cancer has put up videos of cancer patients and how it has impacted people, especially as far as tobacco and smoking is concerned. Something to that effect about symptoms of anemia and what anemia can do to us can also be put in. And I feel that at a political level, at a grassroots level also, if it can be impressed that certain things have to be done, I think the Anemia Mukt Bharat will percolate much better. So things like standees or billboards at stations, railway stations, railway platforms, or in your airports, radio stations. Someone speaks on radio, someone gives a podcast on social media. All these are very good for Anemia Mukt Bharat to kind of percolate into it. And somehow, I mean, we are living in a democracy, so we can't do this, but I've always felt that somehow if we had a rule that anyone who's in the marriageable age, anyone who's going to get married, anyone who's got married, Dr. Kakodkar gave us a beautiful example of how in Goa the marriage, those who get married is informed, and therefore they can approach them. We also should have some kind in all states where it's mandatory to do tests for iron for thalassemia, because awareness is one, but its implementation is second, and its benefit, which you want to see as if it's going to happen in NFHS 6, which we'll come to know, is different. Na? So if we don't percolate, we are not going to see a change. And in fact, the NFHS 4 and 5 have told us that the incidence has increased, which means we are only enumerating the incidence. But how are we going to overcome it? So we have to have certain measures to, maybe mandatory or otherwise, tell people that you have to do certain things so that our incidence comes down. And then, like what Dr. Chirag is saying, that the incidence of thalassemia majors come down, so our need for transplant comes down, so we can put more funding into other areas. Otherwise, we are going to keep putting funding into this and not be able to do it, including for sickle cell anemia. Therefore, it should be mandatory. Some regular health checkup from office, through insurance companies, through LIC, before you take a policy, whatever it might be. That kind of awareness needs to be spread for Anemia Mukt Bharat to become more popular. That's what I feel. Any other question for me?
Thank you so much, sir. Thank you for your insight. Moving forward, my next question is to Dr. Chirag. So, how has the landscape for awareness, diagnosis, and patient acceptance for the treatment of rare blood disorders changed?
Right. So clearly, for uh, the awareness of the rare blood disorders is increased. The family doctors and specialists now uh, take anemia more seriously if they come across, and if they are not successful in treating with iron supplement or B12, they quickly refer to the next level. Many of them themselves order hemoglobin electrophoresis. So that awareness has definitely gone up, and more and more people are getting diagnosed earlier rather than late. Now we don't see those thalasssemic children who have a very late diagnosis and their bone deformities and other issues have happened. That is extremely rare now. Sickle cell disease still, because of the very varied manifestations, and the secondly, I think, because where these people live, the majority of these patients are tribal and low socioeconomic groups, as Mr. Dongre pointed out also. So that is why I think that awareness is lower, but again happening. And the Anemia Mukt Bharat is a very ambitious mission, and which is very good. Also, the sickle cell mission, I went through the website of the whole Anemia Mukt Bharat. So I think that would add to it. And awareness is such that it is never enough. So so like Dr. Bhave also mentioned, many different ways to do this. The celebrities and the leaders need to be roped into this, like we had, say for example, Amitabh Bachchan supported the polio mukt Bharat. So like that, celebrities, women celebrities, all these people need to be roped into this to make it much more success. So it has happened, but there is a lot more to be done. And I am, of the opinion that, in this forum, I would like to just point this out, that alongside these activities, there should also be research on making iron preparations more tolerable and potentially like more long lasting, so that the so imagine if we have an iron preparation which you give once a month only or once in 2 weeks. So the ASHA worker goes at the time of visit, gives, and then the second dose is required after such a long time. So this technical research is also very important. Also, we know from the DOT, the directly observed therapy experience of tuberculosis control, that giving people medicines at home to take by themselves did not work. But when the medicines were given directly under observation, they had to take the tablets in front of the healthcare worker. That led to a much better disease control. Something similar has to be done for anemia also. Instead of just distributing the tablets, there are studies to show already that even if you give the iron tablet only over the weekend, you would still prevent severe anemia. So even if say ASHA workers or these other workers who are in touch with the community ensure that at least one tablet a week or two tablet a week is taken by these target group, the women and children and all, then it would still ensure that very few people would go down to very severe anemia level, because the iron is one drug where the absorption is kind of proportional to the severity of deficiency. So if you are very deficient, then even one tablet a week you will absorb a lot more, or two tablets a week. So, this is something directly observed therapy, and wherever feasible, even intravenous iron should be offered, or some form of parenteral IV or IM again can be done once in 6 months even, and would prevent severe anemia. And there may be a number of people who would be willing to take intravenous injections in 6 months, and it may not be that much of a financial burden, and would we really achieve our goals. One other point, when I looked at the Anemia Mukt Bharat, the preventive supplement is iron and folic acid, and probably some research is required of course in this, but probably B12 needs to be added into the mix, because now we see lot of B12 deficiency anemias also, and that may be one reason why we may not be achieving the goals, one of the different several reasons. So that can be added, just like it is in the I looked at the website, it says that in the fortified food, and the midday meals and others, there is iron, folic acid and B12, all three. But in the preventive supplement, it is only iron and folic acid. So there also I think B12 needs to be added. So those are some of the comments I would like to make.
Thank you so much, sir. Moving forward, my next question is to Dr. Madan. So, what is the current state of testing and treatment of anemia using digital methods and point of care treatment with a special focus on pregnant women?
Okay, thank you. One of the important things has been highlighted by the previous speakers. That means one should be aware about the signs and symptoms. Right now, it's only say that you are anemic and you take treatment. That kind of approach is there. That means you are only reacting to the situation. Even in the pregnant woman, we say that you are anemic, you take treatment, whether the woman want it or not. That kind of awareness is required. It's not that we do it. I will come to the questions later on regarding the point of care service and what kind of testing is available in the government sector. I can talk about the government sector only, not the private sector, because sky is the limit for the private testing, and they can all negotiate with the insurance companies. We can only provide the basic things which can be used for iron screening, as well as the other programs which are there, the sickle cell screening and other things. That kind of facilities are available. Uh, in the other program also, we do are focusing on having an integrated uh, public health laboratories at the district level as well as the block level, wherein the facilities for screening of other blood disorders and other things would be available. That's a work in progress, and some of the places is available, some of the places uh, it will, eventually it will come. That's one thing. Second thing, how to make people aware about anemia, because right now we say that after the screening If the hemoglobin is less than 13, less than 10, less than 8, then you categorize the patient. But whether the patient is aware about her situation, that will be an interesting aspect, because if the patient himself feels that, "Okay, I'm anemic, I require some treatment," then the treatment adherence and other things will work. Otherwise, you are just throwing medicines and the patient will not consume anything. Uh, you see, the problem with the IFA adherence is not the supply, is not the consumption, is the adherence to the regimes and other things which we are suggesting to them. That's another thing. What we are doing, another thing, if you look at the Anemia Mukt Bharat, we have been able to create awareness, but whether we have been able to create a need for getting oneself tested for anemia, volunteer for treatment, that's very different. The answer lies here. We have to find out reason why it is not there. The other supply side issues, like the as we have mentioned in the iron, this anemia Mukt Bharat, we do have a center for excellence which is doing all the research, as my previous speaker has mentioned about the supplementation of B12. And that thought process is already going on. That means, apart from the folic acid, B12 needs to be added as a supplement, so that the B12 deficiency is also being taken care. That is work in progress. But you have to think that still, after having all the modalities, IFA tablet, B12 sufficiency, if the patient feel that whether I want require treatment or not, we have been able to create awareness. After awareness, we have to at least change the behavior of the person, that now you require treatment, you have to adhere so that you can improve. Because this anemia, it usually impacts the capacity of that person, it impacts the cognitive skills, it act on the immune system also. People should understand that thing. It's not only one small thing. You might have seen many people, you talk about the iron formulation, many other iron formulations are there. More than 200, 300 iron formulation would be available over the counter. But still, why people are not coming forward? Because they don't perceive it as a problem for them. They want to live with that. They say that देख लेंगे होगा बाद में करेंगे. You have to bring with the screening. They have to create a need for getting themselves treated, get- understand the symptoms. Even a common headache can be because of anemia. There are many model studies, model interventions, where one of the symptoms is headache. If the person is having persistent headache, if the person was screened for other causes, and anemia was one of the cause for that. In near Delhi, in Delhi NCR, in Gurgaon, one of the NGOs, they are doing it. But these are all small scale projects, and they are trying to see that how the symptoms is, with the symptoms only, people will come forward, get them screened, and get themselves treated. That's one thing. Regarding the screening thing, the age-old method which we have been using, that the Salis hemoglobinometers, for screening purpose is good. And some of the areas we are still using it. If you look at the health structure which we are having in the country, uh, we have fairly having a structure there in the primary healthcare at a population of around, because these all the structures are determined by the Indian Public Health Standards. As per the Indian Public Health Standards, for a population of 3,000 to 5,000, we are having a Ayushman Arogya Mandir, which were erstwhile health and wellness center, which were earlier known as sub health centers. Above that is a primary health center which caters to a population 20 to 30,000 population. And above that is a community health center where the community experience first time it comes in contact with the specialist service. Whereas at the primary health center, they come in contact with the medical officer. Medical facilities are available. First time contact with the qualified healthcare provider, that is medical doctor. But at the community health center or the Ayushman Arogya Mandir, which are now called, at that level, you are having a nurse practitioner or a community health officer. Here, all the facilities are available. Previously, at the sub center, the auxiliary nurse midwife or the ANM, she used to carry out this Salis screening through the Salis method. That is acid hematoglo, uh, uh, using SCL and taking a small prick. They used to at least screen the population for this. Now, with the availability of the hemoglobinometers, the digital hemoglobinometers now are available at all the centers. And now the pregnant women and the other people, they are increasingly being tested through this hemoglobinometer. For screening purpose, is very good. And for monitoring as well as seeing whether the patient is progressing or not, they have giving excellent result. But still, we are in search for an ideal, very cost-effective point of care devices. That's that's a area where a lot of work is required with the 100% precision as well as the 100% specificity and sensitivity. So all the POS are sensitive, but how much specific they are there, we have to just find a accurate solution for that. Till such time, but for our public health programs, this screening is quite sacrosanct and we have been getting good results. But the important challenge rises apart from screening, putting them on treatment. We have been able to address the logistic issues. The adequate availability of IFA is now been ensured in all the places. As you see, the one of the institutional mechanism which has been created under this Anemia Mukt Bharat. Apart from that, apart from creating it, we are trying to focus on changing the behavior of the person, how to make the felt need, and he should understand, the patient or the person needs to understand this is needed. If the person is being able to change his behavior from that means I am diseased to that means I need this thing, so we would be able to at least see much progress, much exponential progress in the Anemia Book Bharat. And still a lot of work is to be done, at least to bring behavioral change. If you, even if you are anemic, I'm just posing a question, whether you will go for a treatment or not, unless you are aware, unless you feel that these symptoms are incapacitating you in your day-to-day discharge of your duties. Unless or until that happens, I have seen patients with 3 anemia in the tribal areas. They're working, and they when comes for the, this ANC checkup, then you find out that they are having three, and they all deliver also with the 3 hemoglobin. I'm not taking pride in that, but saying that for them it's a common occurrence. They don't feel that it needs to be treated. It needs to be this, but we have to see that how to bring all our efforts making inroads into the felt need of that population so that the uptake and the other things which we are envisaging in the program that fructifies. Otherwise, all would be we would be doing from all the supply side intervention, the demand also we will create, but the people should also feel responsible that "Okay, I need to get treated for these symptoms. Otherwise, whatever we will do, we have to do lot more work to get a more desired result. I will stop here. Thank you very much.
Thank you so much, sir, for highlighting the need for behavioral change. With this, I would like to conclude our today's session. Thank you so much to all our esteemed panelists for this insightful and engaging discussion and your valuable time. Thank you for joining us today. On behalf of Voice of Healthcare, I thank all our viewers for joining us in the 4-day-long sessions. With this, I conclude today's session. Thank you. Have an amazing rest of your day.
Thank you,
Thank
Anoushka.
you.
Thank you
Thank
very
you
much.
so much. Thank you so much.